All right, welcome everyone to Mental Health and You, how to lower your stress and find your calm. You're in the right place. My name is Lindsay Aldridge, and I'm the Chief Philanthropy Officer for Providence St. Mary Foundation. We're happy to have such a large group joining us today online. I can see that many more are continuing to dial in and join us as we get started here. Today's event, Mental Health and You, is the first of a series designed to connect you with healthcare experts on topics that are most pressing for our community. And 1 year into the pandemic, I think we can all agree that lowering your stress and finding your calm is something we can all relate to. In just a moment, I'll turn it over to our Chief Executive, Susan Blackburn, to share our reflection, but I first want to introduce you to our panel. Today, you'll be hearing from Dr. Chris Hall, Chief Medical Officer, on where we're at with COVID-19 and the pandemic's impact on healthcare workers right here at Providence St. Mary, as well as our community at large. You'll also hear from Melissa Adams on signs of anxiety and depression and how you can focus on well-being. And finally, Brian Duke with our rehabilitation department will talk about what stress does to our bodies, and he'll also give us some tips on exercises we can do to find our calm. As a reminder, at the end of the presentation, we'll have a Q&A, so please go ahead and type your questions in the chat box on the right-hand side of your screen. Our moderator will continue to watch that chat box and will ask questions to the presenters as we go along, and then also take some time at the end. So with that, I will turn it over to Susan Blackburn, our Chief Executive for Providence St. Mary. And Susan, thanks for kicking us off with our reflection.
Great, thank you. And good afternoon, everyone. I feel privileged to share this mission message about gratitude with you. This was written by Kelly Durgan, who is the Chief Mission Integration Officer at Holy Family in St. Luke's in Spokane. So it begins with the message and then ends with a prayer. February 17th, Ash Wednesday, was the beginning of Lent, though we were unable to mark this occasion in our hospitals with our traditional mass due to COVID. During the season of Lent, many Christian denominations mark these 40 days before Easter with fasting and prayer. Over the years, there have been many Lenten seasons I observed by giving up something. As a child, it was often sweets or chocolate. Some more recent years, I've done something intentional rather than omitting something that didn't serve me well. As I prepare for Lent this year and our COVID restrictions continue, I find myself tiring of the many things I've already given up. Hugs, visible smiles, dinner out, and visitors in our home are just a few. So this year, I'm going to be intentional in my Lenten practice and express gratitude every day. Some days that may be thanking someone for their actions. Some days it may be thanking God for the many gifts he has shared with me. Hearing positive words light up a part of our brain, and that feel-good feeling lasts longer than the conversation. Imagine if many of us took up this cause to express thanks for what may be ordinary kindness. Thanks for holding the door, cleaning off the handle of the grocery cart, or delivering the mail. Thanks to our spouse or child for loading the dishwasher or shoveling the snow. Thanks to our coworker for answering a light or assisting with a task that is hard to do alone. The ethic care also helps build trust and connection on our teams in times when we are often feeling emotionally exhausted. When we express gratitude, something changes in our own brain as well, enhancing our sense of well-being and happiness. For me, this is a great way to prepare for the Easter miracle in my own heart, recognizing the goodness that is happening around me and sharing my gratitude with others. So let us pray. Provident God, help me to see the good around me, even as we continue to feel the strain of the pandemic. By your grace and intercession, help me to recognize you in the ordinary actions of others. May this Lenten season be one of preparation and purpose, readying my heart for Easter miracle by seeing and honoring your goodness all around me. Amen. And next up is Dr. Christopher Hall, who is our Chief Medical Officer. Some of you may remember him from when he was practicing at the Walla Walla Clinic as a pediatrician. He held a number of leadership jobs while he was at the clinic, and then left for the East Coast in Maine and experienced additional leadership roles. They decided that they wanted to come back to Walla Walla and make it their home, and we were fortunate to hire him as our CMO. So Chris, it's up to you now.
Thanks, Susan. It always makes me a little nervous when my boss has to do my introduction, so because I think she could go rogue once in a while and probably sabotage me. So I'm happy to present today with both Melissa and Brian. I'm the boring part of the talk, so I'm sort of the first 10 minutes. So if you make it through this, it gets better as we go along. And Lindsay and Susan asked me to speak on a really broad range of topics. So I'm going to try to get it all in there, but it's going to be a pretty broad range. So the first thing is, this was sort of our high point of what we experienced in COVID. Probably many of you know this. It was pretty well shared in the paper and online and other places. But at one point in Walla Walla County, we were experiencing over 40 new cases a day. Our new case rate, probably this is the number a lot of us know now, but it got over 1,200 per 100,000. I like it. I'm not as smart as some of the other doctors. So I like it when the math gets easy, and when the math gets to the point you can calculate it in 1 per 100. That means that it's way too high, and that's where we were for much of November and December. At one point, we ended up with 26 patients with COVID. Probably 6 or 7 of those were on ventilators, and we had a pretty big census of COVID, probably around 15 to 20 for much of November and December, and so that was really hard on our staff and really hard on the patients. And so we found in October that we weren't being as careful as we could be in our break rooms and other areas. And we ended up with up to about 15 to 20 caregivers that were out with COVID at any one time. It got to be such a big number, and it actually started to really impact our staffing, that we had to start tracking it every single day, as well as we really had to be much more careful in our break rooms. So this is the shameless dog picture. Like many of you, we gave in on a 15-year promise of never having a dog and looking forward to our freedom when the kids are gone. But I like this picture because it shows a sun coming over the hilltop, which is where I feel like we are today. And hopefully many of you are feeling the sun, although it's pretty gray outside. We're down to about 3 or 4 new cases a day. Actually, this last week, it's been closer to 1 or 2. Our new case rate has dropped from 1,200 to more like 34 this last week, so that's a tremendous drop. We're down to 1 hospitalization today with COVID. Nobody's on a ventilator, and we've only had 1 new caregiver with COVID in the last week. Almost all of our staff are vaccinated. We've had almost nobody who's been vaccinated. I can't remember, it's between 0 and 1 of our staff that have been vaccinated that have come down with COVID. So what changed? And this is a lot for all of us, but one of the biggest things that changed during COVID is just how we do our work. We're much more isolated. We have to be much more careful, much more diligent. Everybody has to wear PPE, like all of you. Our patients have changed. They're much sicker, much younger. I know a lot of the folks that look at the patients that have died tend to have a lot of comorbidities, and they tend to be older, but we've had some very young people in their 40s and 50s who have only modest comorbidities or other illnesses that have actually passed. The outcomes haven't been as good as what we're used to. We're used to 98, 99% of our patients in the ICU surviving and getting to go home with their family members, and we didn't see that. We were seeing sometimes 2 or 3 deaths in a week, and we had a couple of nurses that had patients back to back that actually passed away. And the work is a lot harder when somebody has COVID and they're in the ICU and they're on a ventilator. We actually turn them over on their bellies. A lot of you know the term proning. So we turn them over on their bellies for 18 hours out of every 24. And a lot of these patients tend to be a little heavier. And so you physically have to turn them over as gently as possible while you don't dislodge any of their catheters or breathing tubes or anything like that. And so that was really hard work. At the same time, we ask our staff to do it, often working alone, going to the break room alone. And our staff is really used to being really touchy with each other. They're used to hugs and Nurses, it's hard to keep a group of nurses away from hugging each other, or if there's something tough that goes on or a loss in a unit that's really particularly hard, debriefing together. The COVID work made that a lot harder to do. And one of the other things we saw was just our staff and the risk that they were assuming and the risk in the community. They had to get out, they had to come to work, they couldn't shelter in place, and even they had to, unfortunately, in some situations, probably expose some of their family members at home to risk because they were going back and forth to the hospital. So some things we did really early, we got, and I think Susan deserves a lot of this credit, we got very organized very early in the first week or two. Actually, it was kind of funny because Susan came to me and she said, I'm going to have Susan Leathers lead our incident command. Are you okay with that? You're not going to do it. And I think Susan thought I would be disappointed. And inside, I let on like I was kind of disappointed, but I was like, oh, hallelujah, I didn't want that job. So a lot of that work goes to Susan Leathers behind the scenes, who has really ran our incident command, but each of us kind of knew our roles and we found our niche, from our infection preventionist, Elizabeth Bowen, to Tim Davidson leading the physician group. He's also the one that reads the most COVID literature. I help a lot with the communication to the medical staff in the hospital. Our nurse manager is doing tons of work around staffing and safer protocols. And so all that demonstrated that we were very organized and we had to work as a team to pull this off. So at one point we were doing incident command almost every day or every other day, and sometimes very long days. But it was done very well. Some of you might have heard that in some places they had staff that didn't come to work or refused to come to work, and we did not see that. We had people step forward from every area, and actually this picture on the right, which is one of our first mass vaccination events over at the Walla Walla University Church, all of these people had less than 24 hours notice to get here. And you see Dr. Schlicker, who's retired, who could just be sitting out at his winery pouring bottles of wine that we're all jealous of, but he's there and he's volunteered at almost every single vaccination event. But that is just tons of staff in that picture that have worked very, very long days, and we're all in on, getting the first vaccinations out into the community. So we saw a lot of people stepping forward. We also saw people stepping forward in our ICU, in our ER, everywhere, willing to accept that risk, and that was great to see. And then obviously one of the last things, and I'm not going to go into too much detail, is just the development of a vaccine that I feel is extremely safe, but doing it in under 12 months. I think a lot of folks, both in the government, I know we're not supposed to compliment the government, but they got us a safe vaccine or vaccines very quickly, and I'm very appreciative of that. So this is kind of where I think we are today. It's kind of normalish. This picture is actually from Friday night over in Chiawana. And if you want to talk about what has changed, it was weird going to the game at Chiawana, and they actually welcomed you there. They actually were excited to have people and have fans. So it's sort of normal. You get to go watch a football game, but it's sort of weird because you sit, 6 feet apart from each other. You're wearing a mask, and it's weird to be welcomed by people. But the players are all wearing masks, and the cheer team, they give it a lot of credit. I think they have the most fashionable look with their masks. But I think we're getting back to go into our regular sporting events and hopefully soon theater and dance and other things, but I think everything's going to be a little different. I think we're going to see a lot better hand sanitizer use and distancing and mask use for the foreseeable future until we get to a point where it's safe not to wear masks, especially indoors. But it is nice to see, and I don't know, the other day I was leaving for work just a little late and I got stuck behind a school bus. And the first time ever, I actually thought to myself, oh, I'm so glad to see a school bus. Usually I'm behind him and I'm like, oh man. And as a pediatrician, you have to be super careful. One of the things is you can never hit a child coming off a school bus. That's like a career-ending event. And it was so glad to see a school bus on the road with kids on it and everybody wearing masks. So what did we see the effect on our caregivers? Well, it was like a lot of everybody else, maybe a little bit more to the extreme. We saw great fatigue, and this picture is actually from Italy. It's not from Walla Walla. I had a couple photos, but I didn't feel like it would be fair to use them without talking to the staff first. But we saw a lot of really tired faces. We saw people that were working alone. We had to make sure they were getting the breaks they needed. We had to tell people to take their breaks. We had to send out messages. We had to ensure the nurse managers were telling them to take a breaks because they just wouldn't want to leave the bedside. They weren't able to see their friends as much, their family as much. I think it's been incredibly hard on people. And I think the human psyche is one for almost everyone, the human touch, which is now missing, and the human connectedness that we feel when we get to talk with people, especially without masks on and close by and with holding a hand or a hug. That's completely changed this. And I think there's just unbelievable stress for so many. It's same as in the community. The only difference is almost everybody at the hospital is very, very, very employed. But other than that, other than the financial stress, there's just the stress of coming to work and being alone. And it was weird at the height of the COVID to leave the house really early and not see a single person through all of Walla Walla getting to work. That was a really strange feeling. And then the stress just at work of knowing that the patients were going to have a higher risk of dying, and the care was very difficult and very complicated. And at the same time, there was the stress of knowing that you could be exposed, or that we had other caregivers catch it, not usually directly from a patient with COVID, but just of it being in the environment, or catching it from each other, or catching it from a family member at home and then bringing it into work. And so there was unbelievable. And we've seen a lot of just the impact on mental health. In fact, Providence actually made 25 visits free to all caregivers and their family members, and we've recommended a lot of people use those, and that's been really good. One thing that I really think has been huge that I got to see really positive impact was the Honor a Hero Healthcare Hero program that was really brought forward by the foundation, where people can make a gift in honor of one of our caregivers. And I know one of the nurses that stopped me, she didn't quite know what it was when she got it, but she was so touched that a patient would take the time to send a card and a note with a donation in her name. And I think that kind of small recognition has helped a lot. So that's probably plenty from me and talking here. I do want to introduce, I think there'll be time for questions at the end, unless I'm flagged otherwise, but Melissa Adams, she's one of our social workers. She works with our population health, which is just an amazing hardcore group of dedicated caregivers. And she's done a really, really good job. She had her master's degree from Walla Walla University a few years ago. Before that, she had a really active career in engineering and geosciences. She got to do a lot of international travel, and she helped establish an international school in Korea. She's also worked as a farmhand and a hotelier and an EFL teacher. So she's had a really diverse background, and it helps her a lot as a social worker. She's a founding member of the Blue Mountain Health Cooperative. So that's a free counseling center at our Southgate campus that opened just about a month ago, I believe. And she's helping to heal people on their journey and believes everyone has the ability to achieve well-being. And she looks forward to having a licensure in her licensed independent clinical social worker. So one little aside is, I'll tell you, I met Melissa in 2017, and there was a really tough case in the OB, and that really, really difficult and sensitive situation, a really sad situation. And somebody said, oh, we sent our social work student up to deal with it. And I was like, holy smokes, did we really do that? So I went up there, Melissa will tell you this is true. I went up there, I was like, hey, how you doing? I'm Chris, I'm a pediatrician. This sounds a little rough. And she had it so under control, and she had so much composure, and she was so dedicated to helping the family and the patient through this really tough situation that I was instantly impressed with her. So I'll turn it over to Melissa Adams after that. So thank you today for letting me speak.
Thank you, Chris, for that. Oh, sorry. Thanks, Chris, for that introduction. So I'm really excited to be here to talk about anxiety and depression. And we're going to approach this topic from the perspective of well-being and the habits that promote well-being and help us regulate during really stressful times. And we're going to practice some of those habits and possibly get some new resources. So the good news is that anxiety and depression, they're well researched. So we have a lot of evidence that there are certain practices, habits, and treatments that are effective. Today, we're going to talk about 4 out of the many, and those are mindfulness, social connection, gratitude, and sleep. So this is going to be an interactive presentation involving practicing some of the habits we're going to review. Hopefully you won't be sleeping. So to start today's presentation, if we can have the next slide, we're going to do a mindfulness practice. And mindfulness is an awareness practice. And as John Kabat-Zinn defined it, it's the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. So the idea is that we cultivate attention on the body by focusing on the breath, and that will help relieve pain, both physical and emotional. And here are some associated benefits of mindfulness practices. But the first thing we're going to do is really just practice feeling this, experiencing mindfulness. So next slide, we're going to try the Calm Place meditation. And this is from Lauren Hahn of the Anxiety Therapy and Trauma Counseling Center in Orlando. So as we do this practice, just you can keep your eyes open if you'd like. You could go ahead and close them. But this is a helpful practice if you're feeling anxious or disturbed in some way. And this is helpful as sort of resetting and allowing yourself to feel peaceful and calm. So I'd like you to start by bringing your awareness to your breath. And so just really focusing on the natural inhale and exhale of your breathing. Just noticing the flow of your breath. And next, I'd like you to bring your awareness to your feet. Noticing your feet connected to the ground will help you feel settled and grounded. So noticing your feet. And if you're wearing shoes, notice your shoes on your feet and really allowing all of your awareness to come to your feet. And next, move up your body. Just bring your awareness to your legs, even feeling your legs from the insides. So just really allowing your attention to go to your legs. And now moving up your body, bring your awareness to your torso, noticing your clothing on your body, and even begin to notice the subtleties of your clothing moving as you're breathing. Really just become aware of your body right here, right now. And now we'll begin the imagery of the calm place. So I'd like you to bring your mind to a place you have been or would like to go that represents something very peaceful for you. It could be a place in nature like an ocean or the river, a hiking trail, somewhere that you would like to go or feel would be really calming and settling. And when this place is clear in your mind's eye, consider it from your 5 senses. First, what do you see when you look around this place? What do you see in the landscape? The colors, the textures. Notice if the sun is shining. So become aware of what you would see as you look around. And next, bring your awareness to the sounds you would hear, the sounds that are close up or far away, and really take in any calming and soothing sounds that are in this place. And what about scents? What do you smell in this calming place? If you're at the beach, it might be salt water, the sea air, suntan lotion. So just take a moment to take in any of the scents that are in this calming place. And next, I'd like you to take a moment and imagine what this place would feel like on your skin. Are you under the sunlight? In the shade? Is it breezy? So just take a moment to really imagine what it would feel like to be in this place. And now I'd like you to take just a moment to absorb anything else that feels particularly calming and soothing from this calm place. We'll close this practice with 3 soothing inhales and exhales. So inhale and exhale. Inhale, exhale. Inhale and exhale. So how do you feel? Do you notice any changes since we started? This activity and other mindfulness practices can really be done anywhere. So you can practice feeling your feet or taking those 3 really deep and calming breaths or imagining that calm place. And these can help us regulate ourselves during stressful times or when we're managing difficult patients or clients. There are many mindfulness practices that are out there and tools to help, such as Headspace, Calm, Lyra, Choose Well, Will, and many more. Oh, next slide. We're going to move to something that may be, as you can see, my cat is joining, sorry. We're going to go to something that others may find a little bit more stressful and some may be just really excited about, which is that idea about social connection. So what is social connection? Pevi et al. Defines it as the feeling of belonging or feeling close to others. And Epley defines it as almost anything from making eye contact with another person to smiling or being in a long-term relationship. So it's a very broad and general. So what does it mean and why is it important? So you can see from Stanford here, they did a study and here are some benefits of social connection. Social connectivity is that protective factor. It makes us more likely to survive an illness and less vulnerable to premature death. Social connectivity connects us. And as one Yale student wrote, it's the opposite of loneliness. And depression and anxiety are often associated with less social connectivity. So how do we improve social connectivity in the present and post-COVID world? So research would show that even casual connections, such as eye contact and smiling at strangers, can improve health, positivity, and decrease the feelings of anxiety and depression. It indicates that daily interactions, even small ones, matter. So what can we do to increase social interactions? Some folks on the call may be very excited about like the master connectors already, and others of us may struggle when we're at work or even off work to make those connections with others. So the guidance is really just to start where you're comfortable and build from there. So maybe start by saying hi to someone in the coffee line. Oh, next slide. Smile at someone, acknowledge people, calling a friend, organizing a Zoom dinner with family or friends, having an outdoor barbecue now that it's getting warmer. And studies show that practicing gratitude and acknowledging your gratitude to others boosts social connection. So if an opportunity presents, keep your mobile phone tucked away so that you have the ability to interact or accept that smile or say that hello or that make that eye contact. Ask someone to take a walk with you, call a friend while preparing dinner, or organize a date night with a loved one. I'd love to hear your ideas too about things that during this time that you've done or that you look forward to doing. So if you post those in the Q&A, that would be wonderful. Next slide. The third habit that we're going to talk about is gratitude. And Dr. Ammons is a psychologist and researcher from UC Davis, and he defines gratitude as the ability to recognize the good in your life. And Dr. Laura Santos at Yale defines gratitude as the quality of being thankful, a tendency to show appreciation for what one is grateful for. The latter is an important distinction because it draws in the importance of expressing thanks, as well as the habit of being thankful. When we give thanks for everyday things, we make them visible again. They become present in our mind. So gratitude is an important protective factor. It helps build resilience. Gratitude can make us less vulnerable to disease, promote pro-social behavior, and increase the sense of happiness and well-being. It improves emotional and physical health, including sleep disturbances, headaches, gastro problems, respiratory issues, and has even been shown to increase your motivation to exercise. So anything that's going to, increase my motivation to exercise, sign me up. So how do we bring more gratitude into our lives? So let's try something. Picture a person who you are so thankful for. Close your eyes if you want. And imagine them in front of you. Bring them to life. And you can use that from the Calm meditation. You can picture them, use all of your senses. So really bring them to life. And in your mind's eye, tell them how thankful you are for them. And let your body really feel with that feeling of tips of your toes all the way to the end of your hair. Just again, say that thankful, express those thankful feelings for this person. And we're just going to hold that feeling for the count of 10. And then just notice how you feel now that you've said thank you and really allowed yourself to experience that feeling of gratitude. And Mr. Rogers, this is an activity that Mr. Rogers would do here for 60 seconds every day. So other ideas, next slide, for gratitude include keeping a journal. And you can try writing down 5 things every day you're grateful for. If that's too many, try 3. And if it's once a day is too much, then try once a week. And it doesn't have to be big things. My cat, as you can see, has been very interactive, and I can be really grateful for her. And the sun shining, I can be grateful for those things too. My colleagues, my spouse, there are many things to be grateful for. And again, it's bringing those everyday things, making them visible. And it can be big things too. You can keep a jar, write down one thing every day, place it in the jar, and then read them as part of your New Year's ritual at the end of the year. Write a letter to someone telling them how grateful you are for them, what they did. Research would show that hand delivering it or reading it to them will boost your social connectivity and build those positive feelings even more. Prayer, meditation are all things that will help build gratitude, positivity. We can use gratitude to help foster or improve relationships with ourselves and with those around us, like spouses, children, significant others, colleagues, friends, etc. So, and again, other ideas that you have for how you've used gratitude, or please put them in the Q&A. And next slide. The last habit we're going to talk about is sleep. So sleep, why is it important? Well, it's a biological requirement like water, air, and food. Insufficient sleep contributes to poor physical as well as mental health. Short sleep duration impacts memory, cognition, and executive functioning. And how do we improve our sleep? So Dr. Robert Grandner from the World Sleep Day says, set yourself up for success. And I, for one, never really thought that planning for sleep would be something I'd have to do, but we do. We have to plan for sleep. Keeping those regular times when you get up and when you go to bed really helps our bodies recognize when it's time to go to sleep and when it's time to get up. So budget time to wind down. Next slide. Having a bedtime for your electronics that's at least 30 minutes. Some experts say an hour prior to going to sleep. Avoid stimulating news shows, conversations that really amp up your system. And you can see they're here, the sleep practices. So one thing we're going to do just as a final exercise is to take a look at these healthy sleep habits here. And select one. Pick one. And tell yourself a date that you'll start either adding or subtracting something out of your routine. And go ahead and write that down. And then identify someone you're going to tell that you're going to do that. And then identify one thing that might stop you and address it. Okay, next slide. So we've covered a lot of topics today, and remember that changing habits starts with noticing and becoming aware of what we're doing now. To be effective at changing habits, we need to be deliberate and intentional. We also need to be compassionate and non-judgmental with ourselves, because those old habits are seductive, they're familiar, they're comfortable, and they keep us safe. And we may have developed them just for that reason, to keep us safe, but we may have outgrown them. So as we change and try new things, it will take time, like learning any new skill. Ask for help. Talk to those who can help you. And as always, here's my contact information. Please reach out to me. If you have questions, you want to talk, or there's additional resources, please do so. Call me, email me, whatever's convenient. And Blue Mountain Health Cooperative is a new walk-in clinic, free counseling and behavioral health navigation services. So I really appreciate being here today. So thank you very much. And my cat has dislodged my little paper that I had Brian's introduction on. I'm not sure if Caitlin, Brian, I'm sorry, Caitlin or someone else. Brian's a wonderful PT. I've had the pleasure of working with him and with my patients who have needed assistance and getting a wheelchair evaluation and accommodations. And he has always been 120% available and there for my patients. And so I'm just so grateful for him. Thank you.
Thank you so much, Melissa. That was an excellent presentation, and anyone that has had to work from home can certainly understand having animals in the picture. So I will go ahead and introduce our next presenter, Brian Duke, as Melissa mentioned. Brian Duke is our manager of rehabilitation here at Providence St. Mary. He is a doctor of physical therapy, born and raised in Athena, Oregon. And as a physical therapist, Brian is very committed to helping all of his patients improve their lives through movement. Brian feels wholeheartedly that everyone is an athlete if they choose to be, and he's really dedicated to empowering people, especially from underserved populations. Brian volunteers quite a bit and has worked with the Special Olympics, wheelchair and adaptive sports, and many other community activities. So with that, I will turn it over to you, Brian.
Okay. Thank you, Lindsay, and thank you to Melissa as well. I can't think of a better way to go into your public speaking than to have some focus on deep breathing and mindfulness. So that was like perfect for me to be able to go through those techniques. So thank you for that. I appreciate it. And the cat was really awesome. So we've seen Dr. Hall's dog and we've seen Melissa's cat, and I don't have any animals for you, but we do have some cool things about exercise. So again, I'm a doctor of physical therapy, and the providers here, the physical therapists and the occupational therapists, really we're movement experts that help people overcome barriers to moving and living their best life. Today I'm here to talk about the mental health component and how exercise and activity can help you. And it's not new knowledge that exercise can be beneficial in this way. I mean, we've all heard of the runner's high, and we've all heard about how beneficial exercise can be, but it can be challenging, and there can be barriers that prevent us from starting a program. So hopefully today is a springboard for your you starting exercise and activity to help improve your physical but also mental health. So the question that's probably on everyone's mind is, why don't zebras get ulcers? So I'll elaborate a little bit. We all have stress responses. Not all stress is bad. This book that's about why zebras don't get ulcers, it talks about short-term stress versus long-term stress. A zebra doesn't worry about its finances, or it doesn't get stuck in traffic. It has short-term stress, and either they get away from the lion or they don't get away from the lion. The hard part that we face is that we prolong these same stressors, these same stress responses, and we can do it over long periods of time, such as this year, which has been challenging, and that can lead to really, detrimental things for our health. So the reason that zebras don't get stress ulcers is they don't have the chronic aspect. The benefits of stress, why stress is a good thing or can be a good thing. You don't get eaten by a lion, you get your muscles moving, your heart rate's going. It can help prepare you for activity. So that stress response can be beneficial in this manner. The drawback, prolonged stress leads to tissue breakdown. It's not good for us long term. And the takeaway from this book, short-term stress should be used as a tool that we can use for our own benefit. And I'll talk more about how we do that in a couple slides here. Chronic stress is what we want to avoid. And if we have a chronic or a long-term problem, we need a chronic or a long-term solution. With that in mind, the first slide here on dealing with our stress is how do we avoid that overuse stress or prolonged stress. You see that person sitting there in that ideal situation or setup, and we've all been forced, or a lot of us have been forced to go into our home offices, which may or may not be set up perfectly for us. There's a lot that can go into it, but I'm also here to tell you that the best posture isn't any posture. Best posture is movement. You got to move. We are mobile creatures. We have to wiggle. We have to stay active. So just because that's a perfect posture doesn't mean that pain can't start happening. And pain really is our body's way of talking to us. So if our body starts saying, hey, it's time to move, then we need to listen to it. At some certain point, it's going to force us to listen to it by increasing that pain, increasing that communication. So if you start hurting, get moving. That's the signal there. And I'm going to go through a couple exercises we can do as a team to help with that. For the person on the left, that is a posture that probably can't be held for a long time. There's less sand in the timer. Whereas the person in the ideal situation can probably just spend more time there, but they're not fully free. So my challenge to you would be to, every 20 minutes, wiggle, move. We want to, remind our bodies to move in the opposite way than we've been doing for the previous 20 minutes. So at this point in this discussion, we're about 20 or 30 minutes in, so it's a good opportunity for us to go through these. So the first exercise, and we're going to go through these together. Feel free to participate yourself. If we're on a computer here and we're, sitting with our head forward, we want to remind ourselves to move our head backward. So just a reminder about moving our head backward, kind of stretching the back of our heads, because a lot of times our world is in front of us and we like to look forward. So we want to be able to bring our head back and stretch the other side. Same thing with our shoulders. I personally have never done this, but other people I've heard, just joking, I do it all the time. Everyone slouches. It's part of the human experience, I'm convinced. So what we need to do is not avoid this at all costs, because that's impossible. We just need to remind our body to stretch out. If we're sitting, get walking. Every 20 minutes, just go for a quick walk if you can do it. If we're slouching in our lower back, so I'll try to demonstrate again. I'm not sure how it's going to be, but if we're slouching, we want to arch our back. So go backward with our back. And I don't know if you heard it on the screen, but my back actually popped, which is pretty hilarious because I've been in a chair for 30 minutes and it probably needed that. So I thank you for allowing me to get my stretch in. A forward bend. So the same concept applies, getting, bent forward to make sure that we're getting that good stretch. And then that overhead reach. We, as humans, again, we do that without thinking about it. It's about trying to get that every 20 minutes movement in so pain doesn't happen, but also when pain occurs, listening to our body and avoiding that overuse stress. So that's number one. Avoiding what we can control. Some things we can't control, and that's okay. Using the stress response as a tool, as a benefit, stealing all the benefits, all the bang for the buck, immediately today. And I'm going to challenge you to do so after our session today, to go for a walk, to do something active that you enjoy. Today, if you get high or moderate to high intensity activity, you can sleep better, less anxiety, lower blood pressure. And really listen to this part. Be careful, because if you're not careful, then you might actually improve your brain health as well, and your cardiovascular health, and reduce your cancer risk, improve your weight, bone strength, improve your balance, probably improve the resale value on your home. I'm not sure about that last one, but really, I was mainly joking, but you can turn these short-term benefits into long-term benefits, not just for your stress, but for everything, for all different aspects of your health. It's really this stress response, activating that high intensity exercise can be hugely beneficial. And I want to go through now how to prescribe that, how intense, how long, so you can tap into those benefits. The recommended amount of exercise and activity is 150 minutes per week. And that might seem like a lot if we chunk it into 30 minutes, 5 times a day, that's more attainable, whether it's 10 minutes in the morning, 10 minutes lunch, 10 minutes in the evening, whatever you can do, I challenge you to try to get that high intensity exercise. And there's many ways to get this done. It can be walking, it can be, gardening, it can be a lot of things. I'm going to go through those. Right off the bat, I'm going to show you 3. So the first one is just marching, and you may or may not be able to see me very well, but fast marching. So you're just going as fast as you can. Okay, doing that for 2 minutes while you watch your television show, whatever you want to do. Then sit to stands. So you can just go up and down, and you're just gonna be doing that sit to stand for about a minute. A fast walk, you're going on a relaxing walk. Say, for this 5 minutes, I'm gonna go as fast as I can. That's a way to get that high intensity aspect of that exercise. The chart that popped in is a heart rate zone. So 220 minus your age is the standard math equation for your max heart rate. And you can use this, and I'll have it be sent out to everyone attending. You want to be at 85% of your maximum heart rate to attain those benefits. If you have a heart rate monitor, that's great. If you don't, what you can use is the breath test. How out of breath are you? So the right amount of exertion should be to the point where you are unable to hold a normal conversation, but you also can get some words out. So if you're working so hard that you have to talk like this because you're exercising, that's where you want to be. You don't want to be so extreme that you are unable to talk, but you also don't want to be, to the point where we can have a conversation fluidly like this. So using the breath test can be a really beneficial way to gauge how intense it needs to be. And that can increase over time as you get better. You can change it up. So this new picture is going back and forth between aerobic activity and strengthening activities, and making sure you keep your body guessing. It's very important. And the next slide, we're going to start going through those. So the different exercises, there's a website, activity planner from Move Your Way through health.gov, and it really just goes through building your perfect program. Really just enjoy what you already enjoy. And do it to a higher intensity level, or find the ways you already know how to exercise and do it to a higher intensity level. So it can be gardening, it can be biking, it can be walking, it can be hiking, golfing, dancing, stair climbing, it can be swimming, martial arts, workout videos, wheelchair walking, tennis. I've been playing pickleball, which is really fun. I know that's big in the area. Active video games, yoga, yard work, and any of these activities, all of the activities, you can be creative. Find what you enjoy, and that's going to help you sustain it for longer periods. Now, this is important. It's all been important, but I also want you to not push yourself too far. So if you have chronic or severe pain, if you have chest pains, if you have dizziness, muscle spasms, lightheadedness, please, listen to your body, cease exercise, talk to your doctor, or if you have any big questions about your ability to move, then getting a referral to physical therapy or occupational therapy, and talking to your physician about the appropriate level for you. We have resources available for you for physical and occupational and speech therapy, but physical therapy and occupational therapy for the movement experts, and Southgate here, and family medicine and the YMCA. Pop in some pictures there. And so, yeah, bringing up that conversation, taking, the load on your shoulders and getting moving with that. And at your next family practice meeting with your doctor, your wellness check, your yearly exam, you can see if a PT that day. Here's a picture of Kelsey Downey, who's a doctor of physical therapy intern, and she's talking with Grace and Duffy, and they're discussing their normal medical coverage, and she's like, oh, my knee's been hurting. Gives CJ a call and says, hey, let's talk about this. Let's get this done today. And so they have a PT consult, and they collaborate to make that approach. So I just want to make sure that everyone's aware of those opportunities, and that we're here for you. So my challenge for you is to get moving, and your body will thank you for it. Thank you for your time, and I'm going to send it back to Lindsay.
All right, thanks, Brian. Wow, those were excellent presentations. So thank you to Susan and Dr. Hall, Melissa, and of course, Brian. Our hospital is very blessed to have so many amazing caregivers. So hopefully now you're all really relaxed, you're calm, you've moved your body a bit, and hopefully you also wrote down at least one sleep habit that you're either going to start or stop doing, and when you're going to do that and who you're going to tell. I learned a lot today, and that's definitely one thing I'm planning to do. So it looks like we have about 9 minutes left, and we'll go ahead and see what questions have come through. Amy Watkins with the foundation team has been monitoring our chat box. So Amy, what questions do we have?
Hi, thanks, Lindsay. We have a lot of questions and several that were submitted in advance too. So I'm going to throw this first question to Melissa. This one came in on the chat, and we actually got this a similar question multiple times. So the question has to do with social media and how to deal with stressful social media, or how to minimize our reactions to social media.
Great, that's a great question. Some of the general guidance for stress-inducing social media or anger-inducing social media are really to limit your frequency, duration, and the content of the social media that you're consuming. When we have feelings of anger, it can be really we really want to retaliate in some ways sometimes. It can be really tempting to strike back with anger. But research really indicates that this will actually make you angrier, which is counterintuitive. So instead, working things out with your body, like exercising, doing something creative, practicing mindfulness, some of the techniques that we went through today with Brian's presentation, and the mindfulness and the gratitude, getting sleep, all those things will help. And really unplugging has been, some of the recommendations for social media, but that may just not be practical for the world that we live in, and especially for teenagers too. So really just getting into balancing what we're consuming and starting to practice that self-awareness about what feelings are arising when I'm consuming certain types of social media. So really becoming aware of those feelings when you're visiting certain sites, and just maybe limiting that.
Great, thank you, Melissa. This next question I'm going to give to Dr. Hall. The question is, how do you think the pandemic has affected different age groups or segments of our population? And is there any one group that you are particularly concerned about?
Boy, I think it's affected. That's a really good question. I think it has affected the age groups very differently. In the emergency department, we saw absolute numbers, so not just relative increases, but in adults, we saw absolute increases for only 2 diagnoses in the first 8 or 9 months of the pandemic. One was for pneumonia or fever cough, which was the COVID, and the second was for substance and alcohol use disorders. So we saw a huge explosion in young adults and folks that are middle-aged for substance use disorders. In kids, we've seen several things that are really problematic, which is really big increases in depression, symptoms of anxiety, things that are probably directly attributed to their school routines being blown up, or the isolation they're in, or not having connections with friends. And then the other big one that is sort of the tail that we're dealing with right now are sort of the lack of medical care and good health habits. So in kids, once again, we're seeing like really large increases in obesity and weight gain. So one of the pediatricians mentioned in the hallway today, seeing kids with 20, 40, 60-pound weight gain over a year. Just all of a sudden, they're seeing these kids back. And in adults, we're seeing folks that have missed their preventative care, so not getting cholesterol checked, or seeing diabetes get worse and not managed well. Probably we're not exercising as much and not eating as healthy as we were. So I think we're seeing very different. I think we're seeing effect in every age group, but it's very different depending on what the age group is.
Thank you. Brian, this next question I think would be a good one for you, and it also came in a couple of times. So do you have any advice for those of us that really, we have good intentions but we don't really manage to get the exercise done, even if we know we have the time for it and we're kind of, mentally beating ourselves up?
Totally, yeah. I may be wrong about this, but I don't think everyone is destined to be a professional exerciser. People aren't always passionate about exercise, but they are passionate about other things in their life. So what I would recommend is that you pair it to something you do care about, you already are really passionate about, such as if you like walking, turn it into your exercise, or if you love spending time with grandchildren or family, put a picture of them on your wall and say, okay, I'm exercising for you. And so it loops in that part of your life that you really care about, and it'll make you more successful. And it's not meant to be exercise to be better at exercising. It's how do you use it. And so really defining how you're going to use your improved mobility is step number one, and then you can start working backwards to formulating your best exercise program, and also give yourself a break. I talk to people all the time about exercising more, and then I have a busy schedule and I don't exercise. It happens to all of us. So please give yourself a break and maybe do a weekly reset and say, okay, last week I was busy. It's my weekly reset. I'm going to go for it. I'm going to get back on it. So, I think that with that, I think you'll be set up for success.
Thanks, Brian. You made me feel better. I'm sure you made some other people feel better too. I think any of you could probably answer this, but I think I'll start with Melissa. Any tips for teens or parents of teens related to lowering stress, and how our parents can be good motivators during this time?
Sure. That's another really great question. Just some general tips for teens, and that can be general for everyone too: getting that exercise, regular sleep, getting healthy meals, connecting, making social connections, engaging in helping others, limiting social media exposure if you're discovering that it's causing stress. And teens can help control stress by learning those self-regulation techniques like mindfulness, and becoming aware of activities and thoughts that are causing the stress and starting to track when they happen. So identifying what the stressor is, like I go to the specific social media site, I have these feelings. If these topics come up within my family, or these things happen, I've experienced these types of feelings when I see X on TV. And if we begin to really understand what those stressors are, then we can teach and help our teens interrupt that reaction and practice behavior that can help mitigate the stress. So that can help build the habit of self-awareness and self-management over time. For parents, learn as much as possible about what the stress is, those stress-inducing factors. Discover if there's like a underlying mental health condition. This knowledge will give you some practical insight. Show interest and listen carefully. Listening is such a powerful tool, and it really helps to try to, it's hard, move beyond the emotion to really understanding what's underneath. What is that pain? What is that confusion? What is that anxiety? Find support for yourself is really critical. So learning to manage ourselves and having that self-regulation and self-awareness is going to be really critical for helping to manage and work effectively with our children. Express your support out loud, making sure that they know, and you can practice. I'll give you a couple little talking points too, and don't give up. You may say things like, I've noticed you haven't been acting like yourself lately. Is there something going on? I've noticed you've been sleeping less or more, eating more or less. Is everything okay? And it worries me when I hear you talking like this or saying these things. Do you feel like we need to talk to somebody about it? And seeking help. the counseling help if needed. And there's sites like NAMI, APA, SAMHSA, CDC, all have great resources for teens, for parents, for just everyone. They're very content-rich websites. And reach out to us as well if you need any additional services or connections or resources or ideas. Please feel free to contact us.
All right. Well, thank you so much, everyone. Again, thank you to our presenters. Thank you to everyone who was able to join us today over the last hour. And I also want to thank those who are behind the scenes helping to make all of this happen, Angie Zagalo, Amy Watkins, and Caitlin Resick. So that concludes our hour together, and we really thank you for being here. We'll be sending out a follow-up email to anyone that RSVP'd. We'll also be sharing a recording of the presentation and the slides through our regular e-newsletter that the foundation sends out. So you'll be receiving links to all of this information, as well as some additional resources that our presenters have sent to us as well. Please use these tools. It's been a really stressful time for all of us. Use these tools, and please also share them with anyone that you think would benefit. So that's a wrap, and enjoy the rest of your day, everyone. Take care.